In the afternoon, we're joined right now by Dr. Todd Ellerin, who's the Director of Infectious Diseases at South Shore Health. It's always great to see you, Doc. Thanks for joining us this afternoon. I want to go back to the protesters because there were large numbers of people walking through the streets of Boston. We all saw it. We've gotten some results back from those pop-up test sites for people who participated in recent protests. Nearly 18,000 people were tested. The governor says about 2.5 tested positive. How does that compare with the state numbers statewide?
Yeah, Ed, this is really good news because when you look at where we were in Massachusetts a couple of weeks ago, the overall percentage of positive cases was around 2%. And even right now, it's a little under 2%. So it's all in the same range. And it may be that because the protests were outside or that many of them were wearing masks or moving around, I think this is good news for the state.
So what do you think about the risk of those large gatherings causing a spike in cases? And I'm even looking forward to, I know you don't move when you're at Fenway Park or move when you're in Foxborough, but large gatherings, you know what I'm saying?
Yeah, well, I think, remember, large gatherings are not all the same. I think large gatherings inside where there's poor ventilation, where people are not masks, that's much more problematic.
Doctor, good to see you. We heard from Dr. Fauci this morning, and he told Congress he's very concerned, and I'm quoting, about a disturbing surge of infections, especially in the South and the West. So what worries you most about the trends right now?
Hi, Maria. So first of all, the good news is that in Massachusetts, and I don't even want to say it to jinx us, we're about the best state right now. We have the lowest transmission rate. The R0, the reproductive number of the virus, is extremely low. The percentage of cases is really the lowest in the U.S. right now. So in the Sun Belt, the southern cases like Arizona and Florida, Texas, we're seeing much higher numbers. It's a spike, and it's concerning because we're seeing in a lot of these states that these people haven't necessarily been masked as much outdoors, concerned about opening up too quickly. Again, don't want to be too judgmental, but as we're seeing these numbers, we have to react. I think Dr. Fauci said in the next 2 weeks are critical to make sure that these states get everything, under control. And we have to be concerned that Massachusetts, could get there again. So we have to be really careful.
So to that point, Doc, is it possible that the virus has mutated in such a way that it's becoming more contagious or maybe even more deadly?
Okay, so, the virus has mutated, but not nearly as much as influenza mutates. Probably influenza mutates twice as often as COVID-19. But, we know that there's, for instance, a China strain that we've seen in a European strain. The European strain hit New York. And in Chicago right now, there's the old China strain is going through there. But just because the virus is mutating doesn't mean that it's transmitting differently, doesn't mean that it's killing patients more. We have not seen that yet. There's no proof that these mutations have caused a real critical difference.
What's the last thing right now, today, at this moment, you want people to know?
Well, I think that what our infection prevention bundle is really working. The masking slows down the virus. The fact that we're still socially distanced slows down the virus. And even as we open up, and some of that will be less, I think the most important thing, though, right now is for the people that are still vulnerable and the elderly, we really want to take that slow. And we want to make sure as restaurants open, you don't necessarily want to be the first ones to go inside. I think outside dining is still better, or still dining at home is safest.
Great job, Doc,
You've
as
been
always.
consistent with that message.
Thank you.
All right, Dr. Todd Ellerin,
Be
South
well.
Shore Health. Thank you. Be well.
Great to see you, Doc. All right, let's...